If you look at just about any list of which places have handled the pandemic the best, Taiwan is usually at or near the top of the list. The statistics say it all. With a population of almost 25 million, the island has had fewer than 10 deaths and just about 500 cases. By comparison, New York State, with 19 million people, has had more than 33,000 deaths. So per capita, the U.S. has had almost 2,000 times the number of deaths as Taiwan and almost 1,000 times the number of infections. There were more known cases on one cruise ship in February, the Diamond Princess, than Taiwan has had since COVID-19 first emerged. How did Taiwan do it? Well, many point to Taiwan's great good fortune of having had a vice president who is also an epidemiologist. His name is Chen Jianren, and he joins me now from Taipei. Welcome, sir.
It's really my pleasure and honor to join.
You're an American-trained epidemiologist, a Johns Hopkins-trained epidemiologist. Were you surprised at how poorly America handled COVID-19?
At the very beginning, the contagious probability had not been well recognized. That's maybe the reason why at the very beginning people ignored it, and they also didn't consider that personal hygiene and social distancing and this avoidance of large gathering is very important. Unfortunately, you took a very strong effort to lock down a city, but city lockdown is not a good way. The very careful contact tracing and very stringent quarantine of the close contact are the best way to contain this COVID-19. And I think that we always learn from this the disasters, and I think the situation in the United States is getting better and better because a lot of the general public, they know how to fight against the COVID-19 very well now.
Now, your testing and tracing program has been lauded everywhere. Part of what made it succeed is you have a single payer system, so you have a single unified healthcare system, you have a health card, you have electronic information, all of it pooled centrally. Do you think that was key to being able to, detect cases and trace back to potential infections?
Yes, you are totally right. We did not lock down any city, and we did not do any kind of mass screening. Instead, we do a very stringent close contact tracing and tracking. And we did not do mass screening, but we do a very careful testing of all the suspects with the compatible symptom and signs. And in this way, we consider it is more efficient and also more effective. And through this way, we definitely have to combine this home quarantine. We implemented 14 days on home quarantine for those who were close contact of confirmed cases. And this close contact has to stay at home for 14 days without going to anywhere. And among those 250,000 people who have been quarantined or isolated, basically 99.5% of them are following government's guideline very well. Only 0.4% of them got the penalty because they move out of their so-called restricted area.
So I want people to understand how this works, because I have a friend who went to Taiwan. When you're quarantined, it's not a voluntary thing in the sense that you are given some kind of an electronic device, a cell phone. You are placed in a hotel, and you are checked on. And if you are somewhere, if the phone rings and you don't pick it up, you've left the phone at home and gone outside, you are apprehended. It is a very strict quarantine. But by doing that, you were able to have no national lockdown. Businesses were able to stay open. Restaurants were able to stay open, right?
Yes. Basically, I always say that we have sacrificed 250,000 people's freedom. Everybody have the sacrifice for 14 days. But through this kind of home quarantine, we can assure that 23 million people in Taiwan, we can work normally, go to school normally, and live normally. So it's a kind of sacrifice of a small group of the people in the country, and then assure that all the other peoples at large, and they can live normally. And this is the way we try to contain COVID-19 and reduce the economic decline in Taiwan.
Now, while you were vice president, you criticized the WHO. You said that Taiwan has been orphans in the global healthcare system. Of course, a lot of that is because of the People's Republic of China. Do you believe that China, mainland China, deceived the world at the start in terms of COVID?
Basically, according to the paper published in New England Journal of Medicine, and we found that in December, there's already a huge group of atypical pneumonia cases, and they did not report it to WHO. If WHO received the information and helped China to contain the COVID-19 in December, I think there's in Wuhan, the disease can be contained there quite well. And there's no way to spread out to the whole world. And so I think that at the very beginning in Wuhan, they should do that. And furthermore, in Wuhan, they only took care of there's severe cases in the hospital, and they ignore there's milder cases, and then let them go out to the community and spread out the virus to their colleagues, to their classmates, or to their family members. And this is really, unfortunately, to cause this large-scale outbreak in Wuhan.
Where do you think we are now for the next few months? Is the virus exhausting itself, as some people believe? Is it still as virulent, and we still need to be as vigilant? How would you describe the next few months?
I think the first wave of this pandemic has not gone at all. It's still there and persists very well. And if we look at this, the number of increasing cases is still going on. So we have to be very careful.
Vice President Chen, pleasure to have you on, sir.
It is really my pleasure. Thank you very much.